This is Agricultural Science, and I'm your instructor, Janet White Taylor. And we'll be looking at pests and diseases of farm animals. Let's begin. So today, students, we are going to look at the pests and diseases of farm animals that affect our animals in the Caribbean. And as we move on, these are the objectives we want to achieve today. 1, describe the general signs of illness in farm animals. 2, identify the cause, clinical signs, prevention and control of pests and diseases of poultry and rabbits. 3, identify the cause, clinical signs, prevention and control of pests and diseases of livestock. And 4, understand good agricultural practices to avoid the major pests and diseases that affect livestock. And finally, we want to be able to implement control measures for various pests and diseases. Let us now look at a definition for pest. A pest is a destructive insect or animal that attacks crops, food, and livestock and is harmful to humans or human concerns. So a very important pest in agriculture is rat. Next definition, we want to look at disease. A disease is a disorder or any condition which makes the animal not normal and less productive. In order for us to address disease problems, we have to pay attention to correct feeding, good sanitation, good nutrition as well, and to make sure that all the practices that we are carrying out, we are carrying them out correctly so as to discourage diseases. So as agricultural practitioners, students and farmers out there, when you go to look at your animals, we have to be able to identify or to see if our animals are healthy or not. How would we know if the animals that we are raising are healthy? The animals are going to be alert and responsive to environmental stimuli. The eyes of the animals are going to be bright with no mucus on the sides or the eyelids. And in Jamaica, we would refer to that as matter eyes. We don't want the animal eyes to look like that. And if the animal is healthy too, the animal will also watch you. The animal will have a cold, wet nose. The coat is smooth with a sheen. And the appetite is going to be very good if the animal is healthy. So we have here on screen the picture of 2 animals. We have a poultry right here, Leo. The eyes of this animal is bright and alert. The animal is watching you. And then the next picture, we have a dog, very bright and alert, because when animals are healthy, they are going to watch you. Good? Another thing we want to look at are examples of coats of healthy animals. If the animals are healthy, students, the coat is going to be smooth. It's not going to be looking ruffled. And as you can see, we have a dairy cattle there, very, very smooth. And then we have the Barbados black-belly sheep, and we are seeing that the coat has a shiny sheen as well. These appearances are appearances of healthy animals. Other characteristics as we move on, the animal is going to produce relatively firm feces without straining. And so when you walk inside your poultry house, for example, students, you need to observe and observe and observe. You're looking at the animals, looking into their eyes. You're looking at their stance. Are they moving around or are they limping? You're also examining their feces to make sure that the animals are healthy. So I said students are on duty over the weekend, and students did not turn up. I will know when I enter the fowl pen, because the first thing that I'm going to examine is the feces of the animals. And if the feces are looking green in color, then I know that somebody did not do their duty. So these observations that we carry out, it's very, very important for us to ensure that our animals remain healthy. If the animal is healthy, students, the animal is going to bleat, grunt, or moves normally and does not sound distressed, does not limp when walking, and mixes with the flock or herd and is not isolated. So if you enter your house and you're seeing that the animal is all by himself or herself, you know that something is wrong with that animal. Animals like to lime and to mix with each other. Good? If the animal is healthy too, the animal will have what we call a normal stance. This means that the animal is going to stand, yes? And the animal too will have what we call a normal rectal temperature of its class. So for poultry, you're going to have 41 degrees Celsius. For goats and sheep, 39.4 degrees Celsius. For pigs, 39.2 degrees Celsius. And for cattle, 38.6 degrees Celsius. So just for us to go back to recap what a healthy animal will look like. You're seeing this dairy cattle right here. Good stance, yes. The coat of the animal, you're seeing the sheen, and the animal is very alert. The animal is watching you. And of course, the animal will be able to consume the feed as well. So it's very important. As you move around in your community, you're looking at the animals that you're seeing, and you can come to a conclusion based on what you're seeing on the outward appearance. You can say, yes, the animals that I'm seeing, they are healthy animals. Good? Let us now move on to look at characteristics of unhealthy animals. If the animal is not healthy, students, you're going to see the eyes looking watery with mucus coming from the sides and eyelids. It is an indication that the animal is not well. The coat is going to be dull and ruffled with swellings or lesions on the skin. The animal will have a poor appetite and then becomes listless. That means low in energy. And the urine is going to be discolored. It could be reddish or greenish in color. The animal too will be what we call constipated, having difficulty in passing their feces, or they'll be having scoring. That means they'll have a loose stool or diarrhea. The animal too, if this animal is unhealthy, will be shivering or groaning in pain. So we are looking to what we talk about alertness. If the animal is not healthy, the animal is going to lack alertness and fails to respond quickly to environmental stimuli, as seen in this picture here. The animal will want to look like it wants to sleep all the time, looking sleepy and have no energy at all to move around. Other characteristics, the animal will show signs of fever, that is high rectal temperature. Good. And in poultry, signs of ill health is going to include loss of appetite and also respiratory problems. You may walk inside your pen and you're going to hear the animals coughing and wheezing. And then you know that something is wrong with your chickens that you have inside your house. So observations inside your pen, students, and I must repeat it, it's very, very important, because when you're able to tell if your animals are healthy or unhealthy, then it means that you're a good manager and you'll be able to manage your business in such a way that you'll be able to make a profit when it's time for you to slaughter your animals, or if you're dealing with picking up your eggs and so on. Good? So just to give you an example, by looking at this picture right here, on my left, you're seeing the animals they're feeding. The coat is looking dull and ruffled. Yes, and you're seeing the next animal with what we call skin lesions. This is an indication too that these animals are not healthy at all. Good? So it's not just to say that, boy, you're looking for certain things. You're able now, based on what you're seeing now, you can see based on the coat what is happening with the health of your animals. So just to continue by looking at other characteristics of unhealthy animals, the animal is going to walk slowly with discomfort, or it's going to want to lie down for long periods. It's going to lack energy to stand up. General dullness and droopiness. The ears will not be what we call very alert or responsive, drooping ears, coughing, sneezing, noisy breathing sounds, and the animal too will be isolated from the flock or herd, being unable to keep up, especially when they are grazing or walking. So just to give you an example of what an unhealthy animal looks like, the animal is lying down for long periods, unable to get up. The animal is just looking droopy all the time, because healthy animals will have a good stance. Yes? And this is very, very important. So what we have looked at so far, students, we have looked at the characteristics of healthy animals and some characteristics too of unhealthy animals. We need to bear these things in mind because it is important as we continue to manage the livestock and the poultry and rabbits that we are raising. We now want to continue by looking at the pests and diseases of poultry. And so we want to look at 4 diseases today in terms of pests and diseases. We want to look at the Newcastle disease. We want to look at coccidiosis. We want to look at Marek's disease. And we also want to look at the flu as well, the avian influenza. Let us now look at the Newcastle disease. And once we start to look at diseases, students, you must know what caused that disease, what are the symptoms, and how we can prevent or control that disease. So that is what we want to zero in on in this section of the presentation. So for Newcastle disease, the symptoms that you're going to be able to see, the chickens are going to have loss of appetite, droopiness, nasal mucus discharge, twitching of head and neck, breathing difficulties, paralysis and sudden death. Mortality rate is high. Prevention and control. There is no treatment for infected birds. Young chicks should be vaccinated. Adopt sanitary measures by using a foot bath, cleaning and disinfecting poultry pens, feeders and waterers. And remember, students, dead birds should be buried or burned because we want to ensure that we are not going to pass on the disease to the rest of the flock. So we need to remove them, and then we need to bury them or burn them. If we are going to bury animals that come down with diseases, we need to bury them far from the water source because we do not want to contaminate the water sources that we have on our farms. Good? Let us move on now to look at fowl-pox disease, and it's caused by a virus. So while we as humans have chicken pox, the chickens are going to have what we call fowl-pox disease. What are the symptoms, students? You're going to see warts, lesions, or blisters on the comb, wattle, eyelids, face, and legs. And the mortality rate is low to moderate. Prevention and control. There's no treatment for infected birds. But young birds should be vaccinated, and all infected birds should be isolated, and carcasses should be buried or burned. Let's move on to look at picture of the fowl-pox, showing the warts on the comb of that chicken right there, and you're also seeing warts over the eyelids as well. That is when the chickens come down with the fowl-pox disease. So it's very, very evident. Sometimes you can see those lesions on the legs as well. So you're able to see, and then we know that we need to isolate these chickens. Good? Next disease we want to look at is the Marek's disease, and it is caused by a herpes virus. And so we need to know the symptoms, prevention and control. Sometimes when we purchase our chickens from the farm store, as soon as we get them, as young as we get them, we are able to see in that batch of chickens that we raise, maybe 1, 2, or 3 that have signs of the Marek's disease. So we want to look at so that you students at school, you'll be able to identify what are some of the symptoms if your chickens inside your house have the Marek's disease. Good? So you're going to have what we call twisting of the head and the neck, droopy wings, loss of weight, because these chickens will not be able to develop as fast as the other chickens. The other chickens are moving up, you're raising your waterers and your feeders, and these animals will not be able to get there to eat, so you really have to isolate them. The gray color of the iris, then you're going to have paralysis of these chickens followed by death. And disease can take several forms, and the mortality rate is high. Prevention and control. There is no treatment for infected birds. Day-old chicks should be vaccinated. And remember, students, strict hygiene should be followed. Isolate infected birds and burn or bury the carcasses. However, there are resistant strains now available so that we can ensure that when we purchase our chickens from the farm store, we are getting good quality or chickens that have what we call the strains, that they will not come down with the Marek's disease. Good? So far we have looked at smallpox, we have looked at Newcastle disease, we have just looked at Marek's in terms of poultry production. We want to move on now, and you're looking at a picture of the Marek's disease, and this is just one of the symptoms. You're seeing where the chicken have what we call outstretched legs. These legs can't bend at all. One forward and one backward. Sometimes the neck is twisted in a very uncomfortable position, and it's difficult for these chickens to really survive and to be productive in the flock. Moving on, we want to look at next disease. This is very, very important, especially here in our region, and that is coccidiosis, and this disease is caused by a protozoan. Good? Now, it's very important for us to carry out observations, because if we are not observing things inside our house, simple things will miss us, and especially coccidiosis. And so I want to go on now to look at the symptoms of coccidiosis. Good? The animal is going to become droopy, loss of appetite. There's going to be diarrhea with blood in the feces or streaks of blood. So that is why you have to make sure that you take the observation, take it seriously when you go inside the house. Don't just rush inside your house and then just feed and get out. You have to make sure that you're observing everything. The vent or cloaca of the chicken is going to become swollen and bloody and look kind of messy too. There's going to be thriftlessness, then finally death. However, the mortality rate is moderate. So students, if you go inside your house tomorrow and you're seeing signs of the coccidiosis disease, don't panic. If your chickens are, let us say, at 4 weeks, you're weighing them to make sure that you can take them out at 5 weeks. You don't want to take them into 6 weeks because they may not start to die yet. But if you decide to keep them longer, they'll just start to just drop inside the house and die. So what you need to do, find out from your market, what is the weight they required, and you need to slaughter those chickens as quickly as possible. Coccidiosis is not passed on to human beings, so it is okay to consume this meat. So those are the things we need to pay attention to as managers. So you're not going to go in and I ask the question, students, so we have coccidiosis in this house, what are we going to do? You're going to say, kill them and bury them. No, we want to at least give them a few more days or another week, and then we slaughter them so that we are able to make money. We are not going to make the profit we should make because the animal weight now will not be as it should be because of the problem with this disease. Prevention and control, treat with sulfur jugs and magnesium sulfate in the drinking water. Birds should be removed from wet infected litter. And students, once you walk inside your house and the litter is wet, remove it and replace with dry litter. Good? And stocking density should be reduced, and you could practice good sanitation. Also, students, if you are able to recognize the chickens based on the swollen vent, then you can also isolate those chickens. So, for example, at 4 and 5 weeks, we have to be careful too in terms of treating them with drugs, because we don't want to give them medication and then we slaughter soon after. Because if we practice that, then the medication is not going to be in the meat of the chicken, and we as humans, we do not want to consume that. So I'll say at 4 weeks, we're not treating, we want to get them to 5 weeks, slaughter them and get them out of the house. So these are the things in terms of being a manager. And once we become agricultural practitioners, we are managers and we need to know how to manage. And so you don't need to bawl and say, boy, you don't know what to do and what you're going to do. You're just going to be calm and to manage, because at the end of the day, we are in agriculture to make a profit, because farmers must have good income that they can live good lifestyles. Good? So this is just showing you a picture of an animal, a chicken with coccidiosis, with looking at thriftlessness, and you're seeing there bloody droppings right there. And if you could see the vent, it's looking very untidy and swollen because this chicken have the coccidiosis. We want to move on to look at the next disease in chickens, bird flu, or what we call avian influenza, and this is caused by a virus. Now, we need to pay attention to this one because this disease is what we call a notifiable disease. And so what you're going to see, the symptoms, if your chickens come down with the bird flu, swelling of the head, blue coloration of the comb and wattles, loss of appetite. The chicken is going to have breathing problems and diarrhea. And if there are layers, you're going to have drop in egg production and then sudden death. Treatment and control, there is no cure, but good nutrition and sanitation is going to be key. And you want to give them antibiotics as well because this may alleviate the symptoms. Vaccination is not normally recommended as vaccinated birds may remain carriers and infected birds should be isolated. And I say students all the time when you're raising chickens, always, or any animal at all that you're raising at home or on the farm, always practice good sanitation measures. This is key. If you want your animals to be productive and to do well, make sure that the environment is clean. Wash the waterers, wash the feeders, yes? Get the bedding out and all of those things. That's very, very important. If outbreak occurs, then what we need to do is slaughter the birds, bury them, or we can burn the carcasses. So these things are very, very important as we move forward. And as you're doing your SBAs right now, you also need to pay attention because we have to ensure that sanitation is done right throughout the system. Good? We now want to move on now to look at pests and diseases of rabbits because rabbits are also important in the Caribbean as well. And rabbits too, like poultry, they come down with what we call coccidiosis disease. And so we just want to look today at two for rabbits. So we're going to start by looking at snuffles. What are the symptoms for snuffles and what caused this disease? It is caused by a bacterial infection. The symptoms, you're going to be seeing nasal discharge of mucus. The rabbits are going to be sneezing, rubbing off nose and eyes with forepaws. Treatment and control. You can treat the animals, the infected animals, with sulfur drugs and antibiotics. Infected animals, we need to isolate them. You want to give them, feed them a nutritious diet and adopt good sanitary measures. Also in your breeding program, do not breed the infected rabbits. Even if recovery occurs, the animals may still be carriers, and you do not want animals with carriers of disease in your breeding program at all. Right? Let's move on to look at a pest that affects rabbits. And then we have the mange caused by a parasitic mite. And other animals too will come down with mange, even pigs. So if you walk, for example, inside your pen, and you see like the animal is rubbing up against the wall and scratching and scratching and scratching, you know that the animal is having mange. And you're looking and the ear is falling out, and it's looking red and inflamed. That is also a symptom of mange. In rabbits, symptoms are going to be having head shaking, itching and scratching, then a thick crust of mites accumulating inside the ear. Loss of fur, and then you're going to have the sores as well. Treatment and control, you want to massage minerals into the air, mineral oils, and then you want to clean the infected area with an antiseptic solution. You could also apply lime or sulfur ointment. And as usual, and as we say again, so for all of these diseases, we can safely say adopt strict sanitary measures, and you want to clean and disinfect the rabbitry. That's very, very important. So what we have done so far, students, we have looked at pests and diseases affecting rabbits and chickens. And students, when you have your farm, do not put chickens and rabbits on the same building. Because as I said before, both of them are affected by coccidiosis. So these things are very important. Let us move now to look at some revision questions. Question 1. Young chicks were vaccinated to prevent disease infection. The likely disease the chicks were vaccinated against was A, snuffles, B, coccidiosis, C, Newcastle, and D, scaly legs. And so the answer, and I know that you have it right, the answer is C, the Newcastle disease. Good. Moving on to the next question. A goat shows the symptoms: low body temperature, inclination to lie down, soft and highly scented stool. The goat is most likely suffering from A, coccidiosis, B, bloat, C, pneumonia, D, scours. And so the answer is D, scours. And so we have two types of scours, students. We have what we call nutritional scours, and then we have white scours. The difference is that nutritional scours do not have what we call, it is not highly scented, but the white scours is going to be highly scented. So the answer for that question is D, scours. Next question. Which of the following is not likely a nutritional disorder in cows? A, shortage of quality protein. B, deficiency of cobalt. C, excess of trace element copper. And D, excess fluid in the gut. And I know that you're coming along. And so the answer for this question is D, excess fluid in the gut. Good? So we are moving on now, students, to look at pests and diseases of livestock. And we want to pay attention to a term we call notifiable diseases. Now, once you see that, it is telling you that the disease is very serious and special precautions are necessary, because either the disease is likely to spread very quickly to infect nations' entire livestock population. And an example of a notifiable disease is foot and mouth disease. Or the disease presents threat to the health of the human population, such as anthrax and rabies. So we want to always pay attention to this term. Once you see I put in terms of disease and I put notifiable disease, you need to realize that this disease could be a threat either to the nation's livestock or to our health. Good? So we're now going to move in to look at summary of important cattle diseases in the Caribbean. Also, students, some of these diseases are not only affecting cattle, but they're also affecting goats and sheep as well. So we want now to look at the name of the disease, the causative agents, the main symptoms, and the control methods. We're going to start by looking at rabies. It's caused by a virus, main symptoms, paralysis, and we can use in terms of control methods, preventative vaccine. It is a notifiable disease. Good? Next, foot and mouth disease caused by a virus. And you're going to be seeing blisters on the feet and salivation. You could also have the blisters on the mouth as well. The animal is going to be very difficult for the animal to consume their food, so they are going to lose weight. Preventative vaccine in terms of control method, it is also a notifiable disease. Mastitis, this disease is caused by bacteria, where you're going to have the main symptoms: sore udder, flaky milk, and the animals sometimes will come down with a fever, and you can see that they are in pain. Control methods, sanitation, and antibiotics. Foot rot, caused by a bacteria, its main symptoms: lameness, and in terms of control methods, we want to avoid wet conditions. We want to have good foot care out there, and you can give the animals chemical foot bath. It's very, very important, as I said before, to observe the animals, yes? Sometimes you have to take those that have their hoofs and you have to trim them. You want to make sure that your animals are doing well. That is why, too, we tend to put what we call like our goats and so on slatted floor. You want to ensure that they are not staying in wet conditions for long, because you don't want them to come down with foot rot. Good? You don't want that at all, because that is going to limit the amount of money that you're going to make and the productivity of the animal. And once you're investing money into any project at all, you want to make sure that you benefit from the project. And this is very, very important. Good? We want to continue by looking at some other diseases in our region. The next one is ringworm, and it is caused by a fungus. You're going to be seeing in terms of symptoms, ring-like patches on skin, and control methods, we can use Genti and Violet. Next disease, which is very important, especially for cattle, is the anaplasmosis, rickettsia, and it is transmitted by ticks. What are the symptoms? Fever and progressive anemia. And control methods, you want to use tick control and antibiotics in the early stage. So when we talk about tick control, we could either what we call spray the animals or pass them through a dip. Now, once the animal comes down with the tick fever, you have to be very, very careful because the animal is losing blood. They are going to become very, very weak, and it's going to affect their productivity. And you know that in Jamaica, once you're raising cattle out there, if you're going to those pastures, you're going to be seeing tick. But we want to ensure that your animals, they are always protected at all times so that they'll never develop this condition called anaplasmosis. Good? Next disease, we call that heart water, causative agent, rickettsia. It is transmitted by ticks as well. What are the main symptoms? We are going to be seeing the animal will come down with a high fever, muscle twitching. The cattle then is going to be walking in circles, looking confused too because of this disease that we call heart water. It also affects goats and sheep as well. Control methods, you want to be able to eliminate the ticks. You want to look so that you can have treatment very, very early, and you want to treat them with the appropriate and prescribed antibiotics. Good? We now want to move on to look at important parasites of cattle. And parasites, they want to live off other animals. So these cattle now become a host. And so we have to pay attention because we have two types of parasite students. We have external parasites, and we also have internal parasites. And so the parasites of importance, we have looked at them already in terms of looking at anaplasmosis and heart water. It's caused by the parasite, the ticks. It's an external parasite. What are the symptoms or what we call damage to the host? The tick is going to suck the blood of the animal. The animal is going to become anemic. And if there's any open wound, and there will be open wound from these bites from the ticks, it's going to cause some infection. It's going to affect the quality of the skin, because you know in Jamaica that we eat in the cow skin, right? We eat in the pig skin because these things are very important. So you don't want to affect the quality of the skin. You want when persons go to buy these things, they are getting good quality. Good? And ticks also transmit many other diseases. You have like the tick fever, the heart water, and the red water as well. Good? What is the control? You want to have chemical treatment of dips and also spraying the animals. Students, please note, when you're going to spray the animals, do not spray that chemical solution into the eyes of the animals. You want to always protect the eyes. Good? Next important one is what we call roundworms. And these are internal parasites. Damage to host, they're going to have scoring or diarrhea, anemia, and poor productivity. Control, clean pastures, and using deworming medicine. Good? We now want to move on. We have just covered important diseases and parasites of cattle, and some of these diseases affect goat and sheep as well. We are moving on now to look at important diseases in pigs in the Caribbean. And the first one we want to look at is hog cholera. Good? And it's caused by a virus. What are the main symptoms, students? Very high fever, loss of appetite, reddened spots on the skin, severe diarrhea. The animals will also faint, they'll be trembling, they'll go into a coma, and finally death. There's no known cure, but we can give them vaccination at 3 months of age, and this is a notifiable disease because this disease, it could affect the entire nation's herd as well as also affect human as well. So we have to pay close attention when we are raising our pigs. Next disease, dysentery, and it's caused by a bacteria. You're going to have severe diarrhea. Once animals come down with the diarrhea, students, it's going to affect their productivity. Good? But in this diarrhea, we're going to see presence of blood in the feces, and the animal is going to become dehydrated. Control methods, antibiotics, and good sanitation measures must be practiced. Let us look at this revision question, because we have been going through quite a lot. Yes? 1 week after purchasing the pigs, Farmer K notices that the urine of one of the sows is blood-stained. The veterinarian recommends that this pig be treated with antibiotics. Farmer K follows all the instructions for treating the pig, but the pig does not respond. Question: suggest with a reason why the prescribed antibiotics is not effective in treating this condition. So we are saying they just bought the pigs, so we are getting pigs from outside. They are coming inside, right? He's noticing that there is what we call blood-stained urine. And he's doing what the veterinarian is saying, he's treated with antibiotics, but nothing is changing. And suggest a reason. What we now need to do is to ensure that the condition, the environment is very clean. We can move that animal into isolation because we're not sure what is happening there, because we want the animal to recover. When you put animals in isolation, they're able now to rest and to recover. And so with the antibiotics and isolation, we should be able to see some changes in the animal. Good? Next, advise Farmer K of 1 management practices she can adopt to prevent the spread of this disease on her farm. And I'd want to tell Farmer K to practice what we call, you're getting animals from somewhere else, you want to put them in quarantine first, at least 2 weeks, to ensure that they are well, because you don't want them to come into your flock and give your livestock there any disease at all. So I'm saying that we could either isolate them first, or we can put them in quarantine. Good? Let's move on now to look at scours. And this is more common in piglets, but it is also common in other livestock as well. You can have scours in rabbits, in sheep, goats, yes, and cattle as well. Let us now look at nutritional scours. Can be caused by overfeeding and unsanitary conditions. The animals produce watery feces with no offensive smell, and you can treat the animal by giving them cod liver oil, mineral oil, or baking soda. And we need to practice what we call good agricultural practices to avoid pests and diseases of our livestock. The house must be clean and sanitized. Clean the feeders and waterers. Move what we call waste out of the house. Provide good nutritious feed for them. Deworm them regularly. Have your foot bath at the entrance of your house. These things are very, very important. So by definition, we are looking at isolation. We said once the animal is suspected to have a contagious infection, remove them and put them in isolation. And we're using these words now more often now because of COVID-19. Quarantine. We want to protect the animals that are on our farm, so we need to quarantine, place them in a separate area for at least 2 weeks until we are sure that they're not carrying out any disease. Good? If you're going to put them in isolation, make sure that the areas from all other animals and you're paying attention to what we call good sanitation practices, and make sure that you have your foot bath. Yes? And so as well, students, these are just examples of foot bath. You're seeing the cattle there walking through a foot bath, going into the dairy area, and persons or visitors entering your farm, you want them to have put their boots in the foot bath, that they'll take nothing from outside inside and nothing from inside outside. Biosecurity measures, students, very, very important. You want to make sure that any vehicle or persons coming in, you're passing them through the foot bath to ensure that you're protecting your animals as well.